All right. Okay. All right. Before we begin, I just like to let everybody know that we are recording this so that if anything needs to be for at a later date, it will. So just be mindful. So, tonight's meeting is, as you can see, is a joint committee meeting for the education and health meeting to deal with the budget needs, district needs that we always do every year. What you have in front of you are three packages. The first package, let me put it on our screen, is to share. On our screen is this. Is our district needs. So, so what you see here is basically what response we had from 2 years ago. Some positive, no, more negative than positive things were talked in there. We're going to go through it, so you don't have to look at it right this second. But before we go into that part, there's a section that we have that is orange and a section that is blue in your handout. So the orange one is for education, and the blue one is for health care and human services. We put them together because we needed to consolidate. If we did 10 individual one of these, it would be forever. So we wanted to put them together so that we can. The next page. No, isn't
The
it?
beginning.
Next page.
I'm
So
gonna start at the beginning.
Yeah, right.
So we have, as you can see, so so the reason why we have the orange one and the blue one, if you read closely, these are budget requests, things that we can use from the city's resources of their agencies. So if something is here, let's say, number one, they want to provide a new or expand an existing elementary school, that's a capital project because it has the letter C on it. Anything that's an E is expense as usually a program or something that's non-structural. So this is basically what we're going to be looking through for education uh, items. As you can see, I'm not going to go through every one of them. You guys had time to look at it, but we're going to go over what we put in and what the response was from the city or from the DOE. The second one is, let me just put it up, is healthcare, which is health and hospital, Department for Aging, and the homelessness, I think. Something like, no, the homelessness is for housing, sorry. But this is for Department of Aging. So there, they'll ask for capital projects again or expenses of what types of items that we are looking for or are interested in. Some of them, majority of them were turned down, but just because they turned it down doesn't mean that it's not needed. So people have to realize that some of these things are repeated again because those needs are a need for our community. One point which I want,
Somebody's outside.
Barbara, one point that I want to mention to you about this district needs is that this is for 2 years from now. So we're in 2025. This is for FY 2027. So something that is needed right away, like let's say a pothole, we're not waiting 2 years for that pothole to be finished. So something like this is more of a long-term plan versus something that could be immediately addressed. So put that in mind. So something like you see a broken light, you know what? We can request that quicker now than something that is maybe what do you call it? Something that is long term, like a whole strip of light. Okay, so just to put things in content. All right, so we're gonna start off with education, which is the other booklet that you guys got. Well, mine's color, but you guys have is
Oh, okay.
black and white. Yeah, sorry guys. Um, we didn't want to kill too many trees here. All right, so our first part we're going to do is education. If you realize that in education, for capital, the only thing that is really capital is building a school. So what we of course need, because of our new surroundings, our new neighbors, we would like them to have elementary school, middle school, and a high school. So that comes into play on page 14. And priority item number 38. So are you guys up there? Let me see. I was screening down so you guys can see it too on screen. So you don't have to worry about it too much. But on here, we put is number 38. We provide to expand an existing elementary school. As I mentioned, we need this, but of course, they said they cannot support it or accommodate it. Just because they say no, we know that we need it because there's new units coming in and we're putting it in still because eventually they'll realize that with all these units, they have to build a school. But we're telling them now, so 2 years from now, they could say, oh, you know what, they did say it. You know what, we're going to listen to them now. So,
I have a question. On
Sure.
these requests and the reason behind them
Mm.
that they don't support. For example, when we put requests, do we support our request with numbers, with any statistics?
no, we don't have to do it. They know this. The city, the DOE knows the number of accounts. They know. We don't have to tell them what they know already in their reports. Uh,
So do they give them any reason why they don't support it?
They just don't support it, whether it's budget wise or not. They don't say. It just says agency does not support and cannot accommodate. So, because like I said, this year for some reason they put in the word remove request. In the previous year, if you looked at it closely, they never put that in. They had a new feature which we were very disappointed with because all the other district managers had the same problem, saying, "How could you remove this request? This request is needed." The wording is wrong. It's basically they have to reword it properly. So when they say remove request, don't listen to them. We are still putting it back in.
But it says the explanations. Please contact the agency directly and promptly for more info.
Yes.
Yeah.
Yeah.
Do they give the, if you contact them?
We usually have what they call a borough consultation where we meet up with each agency and we ask them why isn't it done. Their response is they have no money. That's the first thing. And then after that, then they say, oh, the numbers doesn't support it. And then after that, everything else just goes down the line where they just say, we just can't do it this year. You know, uh, if we had a person, meaning the elected officials, who would support it, that's something else. But so right now at this time period, we have an outgoing city council person, so his vested interest isn't as deeply involved. But that doesn't mean that the new council person won't have a more vested interest in it. So we putting this in can give them an idea of how to look at future budgeting. So it's very, this is 2 years from now. So things can change in 2 years. How we know the new housing that's coming up, we're gonna have at least 500 units, new units, and in those are definitely gonna have a family with kids.
It is on Coney Island.
Oh, Surf Avenue, right here.
So, okay.
Oh, they're 50. We have 3 buildings. Brand new, brand new. And I can tell you right now, we have 1515 Surf, 1607 Surf Avenue, which is affordable. Over there by Raven Hall. Behind that is going to be another one being built. And then phase 3 is on 17th Street. And on parcel A, which is EDC, they're going to build another one too. And they're all affordable. Okay, yes. Affordable to New York City. Yes, we understand it's not affordable to Coney Island, but based on the yes.
Dollars for
Yeah.
studio.
Well, no, actually, it's about 2,500, 2,025. Yeah, which one? Which one too? Yes, yeah. Rent. Those are rent. Like I said, each one is different based on your income. Thank you. Based on your income. So we can, and those are done by the state and the federal government, how they do the AMI. They are the one that changes it. They right now deal with the city locality, which is New York City, Manhattan. And based on that, we are subjected to their rent affordability. For us, our affordability is less.
States too,
Yeah,
they
but
used to.
the whole thing is
They can't-
they can
Jersey
they
and-
can't figure out how to what do you call it, do it to the district area. Our district area is definitely lower, but they won't. They refuse to do that.
It's a-
That's only one building. That's only
Also
one. There's
divided
3 or
up.
4 buildings coming up. That's 2,000. That's 2,000, and each
But they like-
lottery. Everything is lottery right now, and it's with NYC Housing Connect. But that we'll have a next week's meeting with the housing meeting. So so this we want them to build a school, elementary school, for elementary, intermediate, and high school, which is number 38, 39, and 40. So we're keeping it in. All right. Is there any questions on that? Yeah, but that. Yeah, they are, and that's why it's weird because they are building the one over on Avenue X over there. No, one is by Coney Island Prep, which is coming over here by the McDonald. The other one is coming over by Avenue X and Marlboro, which is John Dewey Middle School. So they are building it, but yet, they're see the people who read this and the people who actually put it in are two different people. They're like, what we read the numbers and then. Well, yeah, that's it. So we're basically telling them, reminding them that this is a need, and it just continues to be there. If it changes,
Can I ask you another question?
Sure.
I don't understand how it works.
mhm.
Department of Education for Brooklyn or for
New York State is New York State.
State.
Yes.
This is community board for this
Mhm.
area.
Yes.
So I'm sure there are a lot of community boards who
Asking
submit
for the same thing. The same thing.
How do they decide which one to choose?
The squeaky wheel gets the oil. That's why it
Okay,
comes. And statistics too, and data. It has to be data run because everything has to be, if there's more seniors that are moving into the units, then they're not gonna build a elementary school. If there's more families moving into these units, then they'll build it based on that. So it depends on who moves into those units, and based on that, what you get. But they won't know until they're built. You see, so that might be a year, 2 years from now. So we have to put this in. We have to be, as they say, proactive than reactive, because when we're reactive, it's too late. Everything's gonna say,
wait, this is for.
2 years from now. Remember, it's not just now. Yeah, that's what you got to remember. All of these things.
The board to follow up, like calling them. send them
They,
back.
they see this. They see this. We scream,
Is
yell,
it-
and shout.
have to
There.
remind
Remember, there's 59 community boards in all of New York City. So 59 of them yelling at them. They said, we get the point. We know you want a school. And it's not only us. It's everywhere else that is being developed. Other places might want to downsize, but that's very rare for a school to downsize. They might downsize because it's old and they have to build a new one. And they have done that. So there are those options. So based on what you have seen in education, those are the only things in capital, right?
Eddie,
There's nothing else that
Eddie,
you build in.
Mark has a
Yes.
question. Mark
Oh,
has a
Mark, go ahead.
question.
Shoot.
Hi, aren't they opening a second school in Brighton 6 to 7? And is that any part of the equation?
Which one? Where is that located?
Uh, between Ocean View and Neptune, 6 to 7?
Yes, they
Um,
Remember
opened
they
up
took
a
over
new-
we had them in here about school dismissal in the middle of the street. And
Oh, that's 253. That was
It's
being
behind that.
expanded.
Oh,
Behind
they're
it, that was
expanding. It's
just
not
an
a new
expansion.
school.
Yeah,
Alright,
it was not a new
fine.
school. It was just an expansion, which is what we put in. And like they said, certain ones need more TLC, and stuff like that.
All right.
And they get it because the squeaky wheel gets the oil. But there are
Right,
two
thank you.
that are coming in, as mentioned, Coney Island Prep, which we voted on, and the other one is the John Dewey Annex for middle school annex, is coming in too. So those are the ones that are for capital projects for what do you call it, for education. All right, so flip the page, which is now we're going to deal with expense. Now, expense, as you can see, is anything that is not capital, which of course means program projects. Not yet. I'm getting to it. The page is page 23. Page 23. Yeah, we skip a lot. And item number 18.
Oh, you're going to 18.
Sure. Oh, which one was that? 22? Maybe. Oh, you're right. Barbara got it. All right. Page 22. Sorry, one page before. Which is number 17. Let me go scroll right up for you guys. All right. This one says adolescent. This they have done some outreach to, where they've gone into. I'm not sure if this is the one where they've gone into the libraries and some after school programs where they gave GEDs. Lakeisha, you might know a little bit more about this than I do. Where we asked them to, give us more enhanced program. And of course, for some reason, they say we don't need it, please remove. But no, we do need it because, the neighborhood is not up to, proficient. So, because I know Liberation had GED class, after school program, FEC had one, for GED program, and and it's needed. So that's number 17. Is there any questions on that? If not, number 18.
You know, it's my second year, it was like 4 years
Sure.
ago. I cannot understand. This is so needy. This that you are pointing out.
Okay.
These programs are so needy, so need.
Yeah,
there
no,
is a
listen.
need for this, and the agency does not support and cannot accommodate it. I don't understand.
You have to realize is this. It is also CBOs. CBOs have to be in the group that is asking for this funding.
What is abuse?
Community-based organization.
Ah.
So any local community groups that wants to deal with, let's say, adolescent GED program, they have to say my membership needs this. If they don't, then it doesn't exist for them. But we know in general for the whole community that we are not up to standard and that it needs to be brought up. So whether you want to eliminate it, we can eliminate it. But I think something like this is needed to say that is there. Is not a top priority. That's why it's number 17. But at the same time, it's not something that is going to be outflanked by another program. All the numbers that you see here are equal. Not there's no, if you're number 5 and number 25, they get the same treatment. So don't feel that because I'm number 17, why is it number 3? It's not that. This number is getting shown to the city agency, and they see it all in one as issues, not as a number preference or priority. Okay. All right. So number 18, which is next page. This is the ESL. Yes, there's a lot needed here. As you know, there's a growing immigration what do you call it, population here in Brighton Beach, in Coney Island. I know that we had a Ukrainian what do you call it, program at the Shorefront Y. And we also had the JCC dealing with second language. And any other groups that what do you call it? These help. The library does it. I know Bright Beach Library does it. Coney Island Library does it too. So they go and gets the service. For some reason, as they say, you can see they said they don't support it and can't accommodate it, and they want to remove it, which is bogus because they don't know what we need. So we're leaving it in there. Is there any discussion on that? Okay. All right. Number 19. Okay. This is, as you can see,
Eddie, move up
DOE.
the screen. Move the slide
Sorry.
up.
Sorry, guys. Number
Thank you.
18, we said we need it for ESL or ESOL now. English of other language. English speaker of, I don't know, of the other language. Thank you. All right. Number 19 is, of course, we need to assign more teaching staff. As you can see, it says with the overdevelopment of the community and overcrowding in classrooms, we need more qualified teaching staff. So this is what we asked the DOE for. But of course, there's a need to make class size smaller. And because of that, you need more teachers because of that now. So of course, they say no, and we're like, yeah, sure, yes, yes, still. Mm, sure. So, and remember, this is for 2 years from now. So it's not like we need it today. No. Yeah. So we're just, preparing them that, look, we still need teaching staff to help us out with the population growth. So, all right, the next one is on page 24, which is number 23. Okay, explain. Yeah, I mean, this basically is trying to get a training skill in the area. They can't support it, of course, that's what they said, but they said resubmit the request still.
Yeah.
So they can see that, yes, there is a
They can
need.
support it, but.
Sure, but just reapply for it. Yes, but yeah, it's just weird how they put it down. But we do know that there's always a need for skill training. So not just looking for employment, but also for a skill training program, and for high school kids too. So that's that's need that we put in, and also number 25, which is other educational program, which is oh, yeah, of course. We realize that the performing and cultural arts has been cut out from the curriculum. There's no place for them to express themselves except for academic and sports. But we need this to be put in. Of course, they said they can't respond. See, this is it. They feel it's not their priority. And yet, something like this, we know that sports and, academic is not the only thing they need. They need performing arts too.
Do they got cut or?
Oh, God.
Got cut, then
Sure.
what was it like last?
I couldn't tell you what it is, but I know that they're getting cut. And if they're going to get cut, we need them to sustain what they have. The next one, I put in, I don't know if it really belongs over here, but is item priority number 26, which is more public art. I don't know if it is here or should it be in parks. I think it might be in parks. Sure. Huh? Okay, this is parks, so don't worry about this, guys. Yeah, see, that's why. Yeah, it's Parks Department. Yeah. All right, so don't worry about that. The next one is number 38 on page 29. All right, 38. This basically, which is always a need or a concern is we need them to provide a housing system for youth that are leaving foster care, and we always feel that there's we need to enhance housing assistance for youth that are leaving foster care. We understand that at the age 18, the young youth, young adults does not have a secure job to afford an apartment, or some type of housing assistance is needed to supplement the rent. And of course, they give the whole thing over here.
But they said they can't
Sure,
support it.
sure, I know, but can't accommodate,
Yeah.
so they are, I guess what they're saying is they want to do it, they have to do it, let's put it that way. Not that they want to do it, they have to do it, because at age 18, they realize too, that with kids leaving high school, just high school, they don't have the skill set, mindset of a job that they could do with continuing their education or doing other things that they have to survive. So they do give it, I'm not gonna read it, but the explanation, but we're gonna leave it in there because it's still needed.
So
for us.
that means agency support and can accommodate.
But it says
remove
but
request.
I'm keeping it in there. I'm keeping it in
Oh,
there.
so
Eddie-
that we're gonna do it anyway.
Eddie,
Yeah,
Lakeisha has a
but-
question.
Oh, yeah, Lakeisha, go ahead.
Hi, good evening,
Young-
everybody. So Eddie, I was thinking that when we
Mm.
put these things in and they give us whatever excuse they give us, why they can or they won't, what about if when we put these things in, we give them some type of data? Because number shows a lot. Not only do we need
Sure.
it, but data shows that this is
Sure.
something that's needed and missing.
You could definitely do
Even
that.
surveys with people asking for these, like especially trade schools. Working with the shelters, seeing what happened after 18. Well, this is the number of people that's coming out the shelters at 18 and didn't have nothing. So if we
Okay.
have like hard proof, I think that would give us a little bit more leeway than just some thinking, well, we just writing it to write it. That's just my opinion.
Okay. No, I think it's definitely good. It's always good to give facts to them. What we need to do is find the right group, or should we say the agency department that will give us this data. Lakeisha, since you're the chair, you and I can help and see where we can dig up this information, because I'm not sure where in the DOE, because this is more in high school side, right? Not the elementary, because you and I, we know about the elementary from the CEC 21, but we have to look more into the high school part and find out how can we get the information for our local youth. Do you know any? Well, we could talk about it. You
Yeah,
know,
we can
I
talk
don't wanna
about
put
it
you on
because
the
we can
spot.
definitely get this
Yeah.
information from the
Okay.
superintendents. That's not a problem.
Oh, okay, yeah. Yeah, because the superintendent from the high school, because do you know who is the superintendent for the high school? I'm not sure.
Prayer. Prayer is one.
Great, okay.
Mhm.
Yeah, okay. Prayer, yeah.
This program that ACS runs.
Yes.
Have you heard about it?
I haven't heard about it, sorry.
Yeah,
Mm.
it starts with, has also doubled the number of youth participating in college choice to
Yeah.
400 who
Mm.
receive college tuition, room and board, tutoring,
Mm.
and a
Yep.
$60 a day
Which
stipend.
is.
Not a bad,
$60.
400,
Yeah, that's not, yeah.
like a lot
Sure.
of money.
Like I said, I'm not sure how this college choice to 400 youth are received in our neighborhood. If this is for the whole New York City,
It might be
we only get
random.
just a sliver, of it.
Whatever it is,
Mm.
it's something that you should, you
Eighteen
know,
hundred a month.
excuse me?
$1,800 a month, but that's tuition. Yeah.
That's in addition to tuition,
Mm,
to room and board,
mm,
and college tuition, room and
Mm.
board, tutoring, and 1800 a month.
mm. All right,
Just
well,
looking
I
at
just
an
wish
extra
they
dollars.
use it
yes, so
for the reason, you know.
okay. All right, so Lakeisha and I will find out some data for this.
Okay, and
Yeah, because
also
like I
that
s-
program, I'm sorry,
Mhm.
Eddie, that program
Yeah.
is for the young people that want to continue their education. There's some kids that feel like college is not for them and they lose out. So those are the 18-year-olds that get lost in the sauce.
Okay. All right. Well, we'll definitely keep this in so that we can find out more data about it and make sure that it continues to help our kids in our neighborhood. All right.
It shouldn't be only college tuition, it could be trade school. People, not everyone wants to go to college.
I'm not sure
Kids-
who
go-
actually
go to
sponsors
trade
that. Sure. Well, like I said, I'm not sure who sponsors it, because whoever does that has to make sure that it gets allocated correctly. So with that, like I said, I'm not sure who would be doing that part. Okay. But right now, let's just concentrate on what we have or what their responses are so that we can work to make sure that we get what we need. The other one is on page 31, which is number 41 and 42. All right, yeah, this is something similar to what they just wrote again. Basically, this is what we were asking for the trade for workforce one, where we lost what do you call it, the office space here, but they still work in the area, which is good. But we should also, as a connect here, is to work with the foster care, because they generally work with the general public, but we want them to also concentrate on this. But of course, their response is the same response that we heard 2 pages ago. Okay, so we're gonna keep that in there with this and see and find out about the data too, because like you said, if this can be, we can figure out what we have. These things can work a little bit better in our part for our kids. All right, number 42. This one is the non-teaching. We assign more non-teaching staff, provide social health and other services.
Eddie, move it
We
up on
just-
the screen, please.
Sorry, Gary. We just want them to we need this additional school psychologists and social workers in our school system. We would like to see this. Oh, this was given by Linda last year about there was a chaplaincy program for the children, which they if they want to have religion or some faith in religion, that they can have a program in there. Of course, their response is they don't support it, and they just want us to remove it. But we definitely need the school's psychologists and social workers for the school system, because as you can see, there's a lot of people who are in need of things. If we leave it unchecked when they're young, it just gets worse later on. So I think definitely we keep that in. All right. Any question with that? Okay, all right, the next one is on page 33. 33, page 33, number 47. All right, this one, this is easy. We just found out that in our other part of our district, they have 7 days, what do you call, library hours, which is in Bay Ridge. We definitely want it still, because something like this, is needed. The more times we give, kids or the community access to the library, the more they would be able to use it. So we can ask for 7 days a week, and also ask for more cultural programs on those days that they are open. So, yep. Okay. Anything else with that? If not, just go to the. Oh, actually, that's the last one of education. All right. Now, before we do anything else, is there anything that we should mention in the educational part? Things that we didn't put in this year, or things that just came up that we should be putting in. Anybody here, education? Okay, I'm gonna mention it because someone mentioned this to me in passing, and they said if we can put this in the budget request. Within the last month or two, they just passed the cell phone lockers. Yeah. So the question is, right now we know that not all the schools can afford it, or not all the school has a program for it. Us asking them to put in requests to have cell phone lockers, whatever, just prepares the kids so that they don't have any unnecessary confrontations. You don't need the kids to be distracted on the phone. You don't need the kids to wear a watch. You don't need kids to have a tablet cheating. We don't need all those excess exterior motives for them to do things that we never had this before 10 years ago. So, but it's something new now that they addressed in the city hall, and it is law that there's no kids to have these things. But of course, schools don't have the funding to do, to figure out how to. Well, they have to do something. They have to do something, but there's no funding for it because this is something new.
They doing
Uh,
they doing it.
yeah, the case says drip shot. Yeah. So and Lakeisha mentioned this that we should have a meeting within the next month or so, just to let the parents or the people in the community how they are doing this, whether it's effective or what's the enforcement behind it. Because if they refuse to do it, then what does that mean? Does it mean suspension? Does it mean I don't know. Like I said, this is so new to all of us that I think is an issue that has to be addressed, so that at least we're aware of it, and whether it needs additional funding in the future, then we can help them out. All right. The second thing, someone mentioned to us that they need a field restoration over by Lafayette High School, the campus over there. That the field is deteriorating, and they were asking us to see if they could find money in the budget, not now, but in the future, for them to be put in as a request. So we said fine. And one other thing on the Lafayette campus was to see if they can do hydroponic lab. I said that would be not a hard request to do a hydroponic. So something like this, all the schools are pretty much having it, but this is on the high school level that they don't have one yet. So I said, you know what, we can put it in too. All right, is there any other thing that in education that missing or an idea? Or if not, okay, because we can go. Well, Lakeisha and I are on it, so we haven't heard anything more than what they're asking. What we just asked. Lakeisha, is there anything that they said that we should be looking into with the what do you call it, with the district needs?
No, I haven't heard anything.
Yeah, I mean, the only thing that, like I said, I talked to Randy Garay, was about the hydroponic lab and the field restoration at Lafayette. But like you mentioned before about the cell phone, how do we work with that in the future? Because, like you said, yes, they might give a bag, what do you call it, magnetic bag package now, but that might not be sufficient. 2 years from now, or it might be worn out after a year or two. We have to find out whatever is needed or whatever is standard, because right now there is no standard. Everyone's doing whatever they're doing, whatever it's in the budget, whatever they have to, but they have to do it because they don't need that distraction. So
It's a mess, right?
it's a mess.
Well,
So
they actually
right,
need,
Lakeisha?
they actually need a better plan because
Yeah. That's it.
those bags, some of the bags that they give, the kids know
Sure.
how to pop them open.
No.
Yes, so
Yeah.
there's been
Sure.
some
Are
issues
they?
already with that.
Sure.
It's only 4 days. You
Yeah.
already
Yes.
figured it out.
You figured it out.
Yeah, these kids
Yeah.
are very smart.
Yeah.
Sure.
Some schools are using sandwich bags, and then they have to, give the bag in.
Back. Yeah.
But I don't think that, and it's not the schools itself. I don't think that the governor really made a strong
Mhm.
plan before executing it. So, yeah,
No.
hopefully she turns around and kind of change it up or fix it.
Yeah. So for
It's
us,
taking an hour and a half for LaGuardia to
Are
get
they?
into school in the morning. His son goes to
Wow.
LaGuardia. Takes an hour and a half. Today he got there at
Sure.
7:15. He didn't get into school until 8:35.
Wow.
They line them up
Sure.
on 10th Avenue, and they're going all the way wrapped around the whole high school.
Sure.
Because of the telephone.
Because they all have to one
Yeah.
by one submit this
Like a
stupid
Maganda
battle
today.
sheet.
Yeah. They had to
Right.
figure out a better plan and a better way of doing it, but it's just right now.
But they signed this into law. They didn't
Yeah.
sign into
That's
law
it.
what the school was gonna provide
Yeah, that's it.
concerned parents
Yep.
if there was a possible lockdown situation.
Showing
And
how
they can't get to their kids, because I had this happen at a local school here in this area
Mhm.
where there was a suspected gun and they had to,
Lockdown,
raid the
yeah.
school and it was
Wow.
in lockdown. And thank God my child had a cell phone,
Mhm.
so we knew she was safe.
Yeah.
Right,
But-
and
but
that's
sometimes-
I'm sorry, Eddie,
Sure.
and that's one of the main issues. Like a lot of schools is saying that they can guarantee that if the kid needs to reach out to the parent or the parent needs to reach out to the kid, that somebody will be there to answer the
That's
phone. But then when you
Sure.
have like Lafayette, 5 schools in one,
Yeah.
it
Right.
becomes a huge issue because now all the kids go in one door. So by the time one group of kids or one school get in, it's already in the second period. So a lot of kids is missing the
Wow.
first period. So it's a lot.
Yeah. But definitely we're gonna have like you mentioned, Lakeisha, is to have a future meeting with whoever is superintendent or whoever is doing this, is to, what have they figured out at this time and what is acceptable? And like I said, we're not gonna figure out at this meeting because like I said, we're not the engineers and and the policy people, but we're the ones that at least want to bring it up to the surface so that people know that we know that it's not going to be finished within 6 months, a year, 2 years, but we want to be ahead of it to see how they're going to implement it as a standard, hopefully as a standard. But anyway, so all right, so for this part of the meeting, we're going to move on to health. Okay, the next part is the blue page for the people who have color and the people who don't have color. This is the blue page, and we're going to start all the way, of course, to number 2. On page 1, number 2. If anyone who doesn't know what number 2 is by now, we want C the L1 level 1 trauma center, which of course we know we need it because of our location near the beach, near the highway, near all these high rises that we're being developed, but yet our nearest one is Lutheran. Is it Lutheran? And Kings County. Those are the ones, and those are easily 15 minutes to a half an hour away in good traffic. So is there any discussion on this? Yeah.
Yeah, I was doing the same.
Sure. Why were you looking at those? You can see up there. It's on the screen too. All right. So, page one, number two. I also send this to you at your house. So you have this, read your email. No, understood. That's why, yes. Sure. Not page one. The back. This one, remember this. Look what's on the screen. But that's what they're seeing is what we're seeing. Sure. Remember what they're seeing on the screen is what we're seeing too. All right, guys. So, capital project for health, of course, is getting a level 1 trauma center, which is needed in South Brooklyn Health. Like I said, they don't have one. Their reasoning is there's not enough funding, and if there is funding for it, it has to be maintained 24/7. So it's a 3-shift, what do you call it, responsibility, and it has to always be on call. So, and of course, their reasoning at that time is that there's no funding for it, so they can't have it.
So
But
is it a need?
oh, definitely, definitely. Like I said,
If
then
you in
sure.
and they know it's over,
Mhm.
you're not going to the nearest hospital.
Sure.
You're gonna go to Maimonides.
Mamani, yes,
It's gonna
Mamani.
take you a half hour
Easily.
minimum to get
Want
there.
to go somewhere?
Yeah, unless you have a private hospital.
So, and they don't, it's not a good thing. But it's a need. So we put that as sure. Yeah. Oh, okay.
They are ready and willing to take on your trauma center.
Okay. See now, if people remember this, this was sent. This was sent. What do you call it? 5 years ago, or more than 5 years ago. But at that time, they didn't have the capability or the funding for it. And based over there, and based on that, the need is still there. Now that is the timing is that, as Barbara said, that now they have a possibility of getting the funding for this trauma center. So like I said, just because they say no at this time doesn't mean that it's no forever. It just means that there's no funding for it or no support for it or whatever. It's not at that time, but it doesn't mean that the need isn't there. So it's still there. So our next part is under capital is on page 7. Page 7, number 15. Now, of course, for the people who don't know by now, Coney Island, Brighton Beach, Gravesend, and Seagate is a NORC community. People who know what a NORC community is, good. It's a naturally occurring retirement community. It's a naturally occurring retirement community. A NORC is senior residents, basically. Out of this, we found out that Coney Island, Community Board 13 has 24% of all of New York City. So that is a lot. And the nearest one is only 18%, which is in Sheepshead Bay. So we're not like neck to neck to somebody. No, we have a lot of people, part of our community that is senior. So based on that, we want a senior center to accommodate them. The last senior center I think was built. When was the last senior center built? Senior housing's been built, but not senior center. The big difference. There is senior housing that's been built on 32nd Street and Surf. Some other ones over here by Raven Hall over there is being built for senior housing, but with the people coming in and fluctuating, infiltrating the neighborhood, there is not enough of the senior services for them. So what we asked them to do in number 17, is it 17? No, number 15, sorry, 15. 15 is to get a senior center. And basically, as you can see, we want a senior center, Public Land is Limited, a multicultural, intergenerational community center on city land is what we need. And what do you call it? And there's land that we pointed to them, which was over by Mark Twain Junior High School, which is that community garden there. It's a full block, but that's what we asked. And of course, they said we can't accommodate this, but resubmit requests, which is interesting. Usually they just say remove, but they understand that it is needed. But within the last 6 months, since we wrote this 2 years ago, if you notice, there is a parcel A, RFP, parcel A that's being developed that's also going to try to connect the Abe Stark skating rink, which is a recreational center for ice skating only. But hopefully, because they have to move that they can make that into a recreational center year round. Because right now it's only being used from October to March, which is ridiculous because what you could do from April to September, you know? So if they're going to move it, the community asked them to do is to put it in there. So what we can change here for Mark Twain Junior High School is also put it in Ape Stark skating rink. So I'm gonna put in Ape Stark skating rink so that they know that we are not just looking at one location, that they can expand to another location too, dealing with the needs. Okay, any question on that? No, okay. All right, so our next part is, actually, the next part is gonna be, all the way to, expense, only because, there's no more, thing besides, a trauma center or a senior center that is capital. Okay, so on page 18, turn to page 18. Right, number, let me see, 6. Okay, this of course, is everyone's favorite. Is animal and pest control requests reducing rats and mosquito population, so we don't discriminate. The pests in our neighborhood, of course, we just want and for some reason they support but can't accommodate. I don't know why, but it's needed. You see, rats from the what do you call it, from tourists, it's become crazy during the summertime. They just need to keep it under control with also construction too. Yes. Mm, mm. Yes. Yes, they are having spring today. No, I know, south of the Belt Parkway, which is weird because I looked at it too and said, why did they stop? The mosquitoes don't see a boundary right there. They just continue south, which is only a little sliver of the area that they're doing, from Bay Ridge, Bensonhurst, and Gravesend. Why didn't they just include Coney Island? I don't know. But we'll, for our sake, we are going to get it because if there's a south wind, we're going to get that spray over the creek. The creek is only 500 feet from Dryer Opperman. Guess what? We're going to get it. So just so that we're aware of it. But we do need it still for whatever thing that comes in the future. So that's for health. All right. Let's see. Next one is on page 20. Um, 20? Is it 20? Yeah. Is enhance number 10. This, as we mentioned, as you can see, that we just need to enhance NORC programs and health services. And the agency supports, but can accommodate.
23%.
Yes, 23.3. It's more. It's more now. Trust me, it's more now. I think it's 24 point something 6. I'll put it in. You'll see it next time. But it's growing. It's growing. It's a quarter of our population that is senior. So, and it's not going down. It's not going down. It's going up. So, but they have to accommodate it. So we ask them to accommodate it. So that's number 10. The next page, number 12. All right, this deals with health issues. This issue with the air quality. Yes, as you heard, they did a study that within the last year, and we were not happy with it because they only tested north of Coney Island with what they had. Because they didn't monitor, we didn't get what they were looking for. Saying that we're okay, we're not okay. So we're gonna put this in again. We're going to ask them to do another study from the EJ Environmental Justice unit, from not from DEP, but from the mayor's office, to see how they can help us with the air quality study. Because right now DEC is the New York State. They're the ones that actually did this report. They did 10 sites, and one of them was north of Coney Island, and that didn't help us with what we were looking for. So, so what we're going to do is request this from EJ, Environmental Justice Unit, from the mayor's department, so that we can ask that specific question about our neighborhood. And whether they answer or not, that's another story, but we're gonna put it in there. Okay. With this is number 14, which is Coney Island. It's the same thing pretty much with the air quality. We just, this is based on Superstorm Sandy about the mode and the port air quality. So what we could do is tie in number 12 and number 14, Barbara, so that it can read as one, because now that we know what the response was from number 12, we can put it into number 14 so that it can work with work with what we really want, is a study for our neighborhood. All right, so let's see, going to the next page, which is 22, and this is number 15. Create, promote, and awareness for preventive chronic disease, including quitting smoking, nutrition, and physical activity, etc. Basically, this is a program dealing with obesity and healthy eating, nutrition, and we want this because in environmental justice community, fresh fruit and vegetables are not widely available to the neighborhood, and because of that, they feed on junk food, and junk food is more affordable for them because it's cheap, 25 cents for a bag of potato chip, snacks that there's 50 cents now. Okay, $1 for things that that kids eat because it's tasty, because you know what, there's no alternative for them. The healthy alternatives aren't there, and if it is there, it's not affordable. So what we wanted them to do is to support this, but of course, but they did say resubmit, so that's a good thing. They realized that we do need something. The next page is 23. On page 23, we have number 20, which is teen pregnancy. We asked this during the health committee back in June, if this was needed, and yes, there's always a need. I think within the last 2 months, there was a community baby shower that they did for the neighborhood because there was a need for it. I think the assemblyman and the state senate supported it during at the YMCA, where they gave formula free information, tips and stuff like that for the maternal for the parents, and I think something like this showing that they had to do it means that there's still a need for programs for this, for teen pregnancy. All right, so that will keep you in. All right, number 22, 21, which is increasing staffing for homebound adult program. We just want them to increase personnel because this is for disabled seniors, and because we're in a North community that this is growing, we know that this is going to be needed for the residents. Okay, so turning to the next page on 26. All right, on page 26, number 28, is to deal with other public issues. dealing with, oh, yeah, well, yeah, some people in the groups are saying that we don't need flu shots and stuff like that, but you know what? Vaccines help, and we need this to continue. So we another thing about what we're also doing, which I haven't resort to, is that certain things that are, if you realize, I put the word continue to support, means that yes, they do support it and they do accommodate it and they do approve it. But we realize that, let's say, Meals for Wheels, we need it for this year, and they say yes, we do it. Please remove it, and we remove it. But come 3 years, 5 years, 10 years from now, that Meals for Wheels is there, and they say we need your support again. But they said, well, you didn't support it for the last 9 years that you didn't put in. So what we did was we put it in the word continue to support. So and if you ever see the word continue to support, means that we understand that they want it, but we don't want it to be lost in the shuffle. Because later on they're gonna say, well, 5 years in a row, you didn't say you didn't need Meals on Wheels. So guess what? We took it off now because there's no demand for it. So we just say we continue to support promoting flu shots. It's a given, but it's not a given now. Now you have to say these things so that they know that it is a need in the neighborhood. All right. So just to point that out. All right. So that's why that's in there on number 28. So the next page is on page 27. All right, number 32. 32 is uh, this is a program they have out there for drug prescription awareness campaign for the community. Um, they just need to know if there's any CBOs to address this problem. We want them to continue this drug prescription awareness campaign. It's needed, because not everyone knows what to do with expired medicine, or what is need for, can they mix it and stuff like that. You know what? Drug prescription awareness campaign will help people who need that information, and it's a need. All right, the next page, we're getting down there, is on page 29. Page 29. All right, is number 39. All right, this is increased transportation service capability. In the past, Rapid Wiener does Project Ride, and it's for the elderly people, and it has done a lot for the neighborhood people who don't have cars or who can't get access ride, for it. So we, of course, being on the edge of Coney Island and in the remote part of the borough, we need this type of service. So we just want to continue to support this. But of course they won't, they can't accommodate, but resubmit. But this is a need in the neighborhood for increased transportation services for us. Okay, and then we get into the last one, guys. All right, on page 32. Page 32 is number 46. 46 is to create, promote, destigmatize mental health and needs and encourage treatment. Basically, we just know that this is a growing need in the
Eddie, move it
neighborhood.
up a little bit.
Oh, sorry, guys. Number 32. Here we go. There we go. 32 and number 46. All right, and as you know, with what do you call it? We have, well, actually with cannabis coming here now, we have people who are on mental health needs. There's not enough support group, psychiatrists groups that deals with mental issues and domestic violence and other things that that we just can't write in here. We need it. And right now, I think there's only one or two. The one on the one on TRU,
PRC.
TRC, the one that's across the street from the Coney Island Library. Reverend Wiener does it. Dr. Lewis, I think it's Dr. Lewis. She's very good. But she's only one that I know of in the whole Coney Island neighborhood. That's a not-for-profit. So the whole thing there is something that deals with wellness treatment and mental wellness treatments. She does a very good job, but is limited to only a certain amount of people who she can handle. So I think something like this is needed. And like you said, this is a stigmatized mental health programs. I think something like this, the more they see, the more they say it's acceptable and not something that they should be shy away from. So other than that, that is all we have for health related issue. So is there anything that we missed or that we should bring up? Certain things that we might have taken out before might be old again, might be new. So is there any discussion on health issues that we missed? I mean, nothing. Anyone in the Zoom gallery?
I think this is Jeff. I think that we
Yes.
should put something in about uh, since the government has said something, the CDC said something about not everybody getting COVID shots.
Oh
I
yeah,
think
yeah.
maybe that's a
Drip
health
shot.
question that we should investigate.
Um, yeah, this is remember, this is for FY 2027. Yeah, hopefully. So what that I think can be addressed immediately. We can just say that we're concerned about upcoming flu season, COVID season, whatever you want to call it season, that things should not be stopped. Yes. Oh, did she? Oh God. All right. Mm.
It's RFK, not the government.
RFK, that's right. Yeah, he did. He did mention it. Yes. I think.
Asking people die of COVID.
Sure.
Didn't happen.
Yeah.
Less than 1 million.
Wow.
And it's not been to the back.
Sure. Okay. Okay. So, based on what she's saying, we're not waiting 2 years to have them respond to this part of it. I think what we could do is we can see that is going to the federal is more talking to our congressman, and find out what they're doing or what their stand is. And maybe this is what we always would like them to do when it's not their election year, is to come by and talk to our members from the elected officials just to give us their update on what's happening, whether it's in federal, state, or local, so that we can hear their stance on it or what they're doing. Because a lot of times, we hear from just only one source, but that doesn't mean it helps our district. So what we could do, Jeff, if it's okay with you, when it's not too busy on the agenda, is to invite an elected official to give us an update on whatever the topic of that time is. Is that good?
Absolutely.
Okay, all right. So whatever we can figure out, well, not the next month or so, because we're gonna be busy with this, but maybe after the election, after November, in November, December, when it's slower, we can ask them to come, or even first of the year. Yeah, before they go back to upstate or before they go back to Washington, we can ask them to update us on what is happening with their what do you call it, their district. Okay, because yeah, something like that. It's good to be in touch with our elected officials so that they know what we're asking for versus just hearing and saying, "Oh, we're hearing only nobody's talking about it," so it's a mute discussion. No, there is a discussion. Yes.
I want to know, because I put it down for you. It explained to me that Cleon is not getting enough of the vaccine. They're giving it to the pharmacies and stuff, and not so much.
So you can go to the pharmacies and get it.
That
Without a prescription.
Yeah.
They said they're not, they can be charged.
that I can't answer only because I don't know the answer, but we can find out. But I'm not sure if it's policy wide or if it's is it funding of who's actually paying for the vaccine. But
it was kind of said by Svetlana that they are going to be ready to give all the flu vaccine and COVID vaccine. I believe the very end of September or the beginning of October.
Oh, okay, all right.
It's a walk-in.
Oh, walk it. All right, well, okay.
Or it's a walk-in,
Correct.
you might have a long wait, but it's a
Sorry,
walk-in.
Konya.
The South Brooklyn Health.
Oh, yeah, sorry. Sorry.
Okay. Okay, all right, so that's the answer for now. I mean, it might change in a month from now, but for the time being, there are enough vaccine, or at least people who are walking in at the hospital to get them. I'm not sure, is that also at the clinic too, or is just only at the hospital, the main branch?
If.
The IDG.
It's not a IDG.
Okay. It's only at the hospital, okay?
At the hospital.
All right, so, is there anything else that we might want to bring up with health that you see that we didn't put in there, or, and if you don't have it now and you think of it later, you could bring it up later, and you know, if it's something that doesn't need to be addressed right this second, then we could put it in. But we'll bring it in during the general board meeting, because at the general board meeting, which is September 25th, we will have a draft of what we have here. Whether they get shifted up and down, some of them, like you said, got merged together. We'll take those out so that it'll be a lesson, hopefully. And anything that needs to be put in, we'll put in as additional at the bottom of the list, only because that's where it's going to start. And that's it. So, just to give you a point of information, tomorrow night is going to be public safety and transportation. So if you're interested, you could come, or you can watch it on Zoom, like some of the people who are doing now. And if you miss those information, you can catch it on YouTube, so that don't feel that because you missed that meeting, you missed everything. No, you can go back and play it on the YouTube channel that we have. And it's on Facebook too. So you could check on Facebook, click on there, it'll go directly there too. Other
Not
than,
all of them area, I can see.
There's a question on Zoom.
On YouTube.
Which one?
Facebook.
which
The
one?
last one.
We had the last one was license. License was the one. Oh, the June. That didn't go through. It wasn't your fault. We're working with the hospital this time. They have WebEx, which we're not too keen about, but you know what? We'll work with what they have. We worked with what we have, which is the OWL, but we realize that why are we creating a wheel if they're using WebEx and it's working for them? Guess what? We're going to try it and use their WebEx to see how it works. So don't feel bad. It's not you. It's not you. Yes, Shawnee. No, WebEx, you have to be in person for that one. That's at the hospital. You have to be in person for that. Nobody gets that. No one gets a buy for that.
All the hospital.
All the hospitals always been in person, always. So, general board meeting, you have to be in person to be counted for. The committee meetings that you have here right now, you could be on Zoom if you're not a member, and for people who gets permission from the gets permission from our chair, he would let you do it if you're sick or something like that. Okay, but that's only when you're voting. If you're not voting, then it doesn't matter. You just listen to that presentation at that time, and it should be
We have
done.
voted.
There's no voting right now. Tonight, there's no voting.
25.
Question on
It's
Zoom?
gonna be on September 25th. We're not voting on this yet. This is going as a draft in front of
Yeah.
everybody, so that in October it will be voted on. So that and the chairs of this committee, you don't have to worry about it. I will be doing this as a wrap up during the district cabinet, the district manager report, so that you don't have to report every single thing that we just said.
Question on
I'll just
Zoom?
make it. Yeah, no, that won't be on Zoom because this is the general board meeting.
No,
This is gonna be
Ron
the
has a
general board meeting.
question.
Oh, yes.
Ron,
Oh, Ron.
Good evening, everyone. Okay, I noticed, I see there's a mistake in the capital with the numbering. Why has that not been corrected? Can you please correct that immediately to stop the confusion? Instead of 1, 2, 3, 4, the order of priorities, it's 1, 1, 2, 2, 3, 3. Please
No,
correct
if you
that.
read closely, it says CS on the back of it. If it says continue support, number one says capital. Number one, it says CS is continue support. All right. There's nothing in there that's continued support for health or for what you call it, education. That's why it wasn't put in there today.
Not
If it dealt
regarding
with you,
education
I
or
would,
health, the full capital list I'm talking about.
yes. If you read at the end of the priority number with the tracking number, it says C and then it says CS. CS stands for continued support, and the other one stands for C as continued support as capital. And tonight there was nothing that dealt with capital for that was in there or continued support. Nothing dealing with continued support, so you guys didn't have to worry about that.
The complete list is accurate in number.
Yeah, if you
Numbering.
take out the continued support, yes, it's accurate.
Okay, thank you.
Okay, all right. So other than that, tomorrow night, like I said, we're gonna have public safety and transportation. The following week, we're gonna have is economic and housing, dealing also with land use, because land use is a separate issue for what do you call it, for the bid, the Cornell bid. And then after that will be the parks and environmental and resiliency to deal with the final parts of the district needs. Anything else that comes up in between can be notified to the office, and anything that what do you call it? It should be discussed that is more long term. Bring it to the office. Anything that's short term can be brought right away. Okay, so don't worry about a pothole or a light that needs to be changed. Do it now. Don't wait 2 years from now to be fixed. That's all. So, other than that, is there any questions? Nothing. I'll give you that later. All right. So, knowing that, the meeting is adjourned for tonight, and motion to adjourn. Motion to adjourn. Motion. No, okay. Yeah, a lot of people. Thank you, guys, and we'll see you tomorrow night.
Good night, everyone. Thank you.
Thank you.
Good night. Good night. Good night.